Strokes are the third most common cause of death in the United States and a leading cause of disabilities. We asked Dr. Stephen Waldman about the different kinds of strokes and their risk factors.
Stroke is a very important problem, causing the third most common cause of death in the United States. 750,000 people have a stroke each year. That's a major cost, about $40 billion a year. So the more we know about stroke and preventing stroke, the better off we are. There are risk factors for stroke, including ones that we have no control of. For instance, our age. Men have a greater risk than women at a certain age. If we've had a prior stroke or a transient ischemic attack, we are at higher risk for stroke, about 3 to 4 times compared to someone else. There's genetic factors. There are other risk factors for stroke that are under our control, that are very important. High blood pressure is the #1 risk factor for stroke. The other risk factors can be diabetes is another one. Also, lifestyles that include alcohol. Small amount of alcohol may be protective. Large amounts can be worsening stroke for various mechanisms. Another very serious one is cigarette smoking, which due to several mechanisms can increase the risk of stroke. In fact, cigarettes have been shown that there is natural clot busting mechanisms, and they decrease in patients who smoke. In fact, when we follow patients who have carotid, that's large artery narrowing with ultrasound studies, only 2 major groups seem to have a progression in that narrowing. Those are people with diabetes and people who smoke cigarettes, indicating how important it is to stop smoking. The important point here is recognition first that a patient has a stroke or a transient ischemic attack. The symptoms of a stroke or a transient ischemic attack, which is a relatively short phenomena of several minutes to 2 or 3 hours usually, are weakness on one side or the other, or potentially both, numbness, that is decreased sensation in a limb or both limbs on one side, decreased vision in one eye or both suddenly, such that there's blurred vision or there's double vision. Another symptom is disequilibrium. Suddenly your balance is off, leaning over to one side or the other. Or gait abnormalities, such as inability to walk straight, sudden change in gait. The other sign is sudden dizziness like vertigo, which usually goes along with other symptoms as well. If any of these symptoms occur suddenly, that usually is a sign of a TIA or stroke. Now, a patient should then make arrangements, usually with an ambulance or calling 911 to come to the hospital immediately. The treatment may be this clot buster, TPA. Also, besides the TPA, however, if that's not used, it's important that the patient have a carotid study to make sure there's not a high-grade stenosis, to have cardiac studies to determine if they're at risk for embolic stroke, and be treated accordingly. That might be with anti-inflammatory medications like the aspirin, or it might be with blood thinners like heparin and Coumadin, and newer thinners that are coming on the market now.